All right, we are live.
Okay. Do we have Roger? I don't see Roger. Yeah, I will call the Tuesday, April 20th, Public Health and Human Services Board to order. Let's start with the agenda. Can we have a motion to approve the agenda, or does anybody have any additions or corrections to make?
Madam Chair, this is Commissioner Mills. I'll move to approve the agenda.
And Swallowson supports.
Vote. Commissioner Mills.
Aye.
Commissioner Swallowson.
Aye.
Commissioner Storley. Commissioner Storley.
Aye.
Commissioner Sullivan.
Aye.
Let's see. Andrea Orest.
Aye.
And Commissioner Hawkins is aye also. And
Madam Chair, I'm having a hard time hearing, and maybe it's just on my end, but it kind of comes in and out. Is anyone else having audio issues?
Yeah, that's happening for me too.
Okay.
I did have audio issues when I was trying to log on. I thought I got it fixed. Am I better yet?
Right now, yep, it was just kind of in and out a little bit there. So I'll certainly speak up if I can't hear something. But
all right, thank you. I'll try to sit a little closer here. All right, then we'll move on to our consent agenda. Is there anything anybody would like to pull for more discussion? If not, do we have a motion to approve the consent agenda?
Madam Chair, this is Commissioner Mills. I'll move to approve the consent agenda.
Have a second.
I'll second. Oh,
Sullivan?
you got it, Andrea.
Andrea, thank you. So we'll do a roll call vote. Commissioner Mills?
Aye.
Andrea Orest?
Aye.
Commissioner Sullivan?
Aye.
Wilson?
Aye.
And Commissioner Storley?
Aye.
And Roger's here now. Roger, would you like to record a vote?
Yes, I will turn my mute off and say aye.
Thank you. And Commissioner Hawkins is also aye, and that passes. So we're going to move on to item social work intern and project. And it's nice to see Sarah here. I hope we can meet in person soon. I will turn this over to Allison to start.
And I'll turn around and turn it back over to Martina, who will give the introduction of Sarah and her project. Martina is the direct supervisor of Sarah, so she will be able to speak much better to her project than me. So please take it away, Martina.
Good morning. I'm Martina Johnson. I'm the Adult and Home and Community-Based Services Supervisor, and I will be the primary supervisor for Sarah McLeod's internship with Cook County Health and Human Services. Sarah reached out to us in February with interest in interning with our agency. She's in a Master's of Social Work program with the University of Central Florida, but she's based in Cook County, and she is doing 14 hours of internship per week, and she'll be with us until early December. So it's quite a long internship. We're really, really excited to have her. She is going to be focusing on addressing the transportation gaps.
Has arrived.
Sorry, was there? Not sure what, okay. She'll be focusing on addressing the transportation gaps and providing a viable solution for individuals in Cook County to access care for their physical, mental, and chemical health needs. She has been gathering a foundation of knowledge just about local options for transportation and connecting with local individuals who provide services to transportation services to people in the community. And now she's going to be branching out to connecting with our regional partners and also moving into the conducting research portion of our plan. So she'll be engaging in that research portion for several weeks. So we'll be determining how we're going to reach out to people, what's the best way to communicate, developing questions that we're going to be asking and getting those surveys out to people here in the coming weeks. So we are very excited to have Sarah. Sarah, if you want to just say a little bit about yourself.
Hi, happy to be here. Yeah, thank you for that introduction. I feel like you covered everything pretty well. If any of you guys have any input on the transportation needs in Cook County, please feel free to reach out. Right now, I'm still open to any and all suggestions or perspective, so I can leave my email in the chat. If any of you guys have any ideas whatsoever, feel free to reach out. Yeah.
So thank you for having us.
Thank you for being here. Do any of the commissioners have any questions or comments? Commissioner Mills?
Thank you, Madam Chair, and just really excited. We all know transportation is very challenging up in Cook County. We have the lower population and a very large geographic area to cover. So very excited to hear just whatever findings could be out there, and very open to suggestions, and excited for any solutions we could find. So thank you for working on this.
I forgot to mention too that we are partnering with the North Shore Healthcare Foundation on Sarah's internship. Valerie Marasco-Eliason is going to be serving as one of the task supervisors, as is Grace Bouchard. So we have a great team of support for Sarah with this project.
Thank you. I have a question. I'm wondering about the research and how you're going to go about this research. How are you going to reach out to the community?
It's a good question, Stacy. We don't have that determined yet. So the next week, we're going to be looking at the options and trying to figure out the best way to reach out to people. So that's still to be developed. It could be surveys that we send out. It could be phone calls, maybe even face-to-face interviews with some people. It could be a combination of all of those things, or just a survey that we send out. We don't have the answer right at this time.
And are you looking at the transportation for all of Cook County, or public health and human services clients, or how are
all of Cook County?
Thank you. I look forward to hearing about what you find out. Do you have a time that you're going to come back before us with some updates?
We do, yes. We're planning to come back in December. So we'll give you an update then.
All right. Thank you. Well, welcome, Sarah. Happy to have you here.
Thank you for having me.
All right. So I guess we'll move on now. Nobody else has any questions? I'm sorry. I'm trying to look around my screen here. If you have any questions, speak up. Let's see. We'll move on to our director's report.
We've got our staff presentation next from Allison Plummer.
Oh, sorry. Jumped ahead. All right, Allison.
Good morning, everyone. I won't turn my camera on because that'll bog down the system when I start sharing my screen, but I'll turn it on later once it's all finished. So I will go ahead and I share. And I believe you also got a copy of this presentation with the materials. All right. All right, so today I am here to give a presentation, an overview of our emergency assistance program. So the topics of the presentation today include an overview of emergency assistance, some historical data that I've compiled and organized, and some proposed policy updates. So what is emergency assistance? So emergency assistance is an economic assistance program that can help with shelter expenses, such as past due rent, a damage deposit, or emergency shelter, all to prevent homelessness. And we can also help with utilities when there is a threat of disconnection. So basically, someone is in threat of losing an item of basic need, think housing or utilities. So this program can assist clients to pay to get them out of those emergency situations. It can also help assist clients to secure permanent housing, such as paying for a security deposit or first month's rent. It can even support a move that is cost effective, even if it's to another county. So the process and procedures. So this program is county administered. That means members of the community work with us, the local agency, to apply for the program. And then our eligibility specialists work with the clients to determine eligibility. The nice thing is that we use the same application for the other programs like SNAP and Cash to also apply for emergency assistance. And this is really nice and efficient because it just reduces the number of applications needed if clients are looking to apply for multiple programs at the same time. So once we receive an application, an interview, apparently that was a hard word today, an interview is conducted, and this can be by phone or in person. Of course, with COVID and restrictions with entering our agency, all interviews now are done by phone. Like other programs, we may request verifications like proof of the emergency, income, and assets. And since this is an emergency, it's important that we look at processing these applications as soon as possible. And that's assuming that clients are also timely in getting their paperwork and required verifications in. So the funding for emergency assistance is budgeted annually. Typically, we budget around $5,000 for what we call our MFIP crisis funds. And these are for families. So families, you have individuals with minor dependent children in the home. And this funding stream runs for a calendar year. So January 1st through December 31st of each year. And now we have a different allocation for what we call emergency general assistance. And this is for single adults or married couples. There are no minor dependents in the household. And this funding stream runs with the state fiscal year, which is July 1st through June 30th of each year. And typically that allocation we receive is the minimum $1,000. Now, there are different funding sources dependent on who's applying. Again, whether you're looking at a family or single adult or married children without those dependents. So the MFIP Consolidated Fund. So MFIP, we've heard this word before when it comes to our family cash program. It's the Minnesota Family Investment Program. So the MFIP Consolidated Fund is an allocation that we receive from the state to help cover expenses to administer the family cash programs. And through this allocation, we are able to help cover expenses like our contract with AEOA to provide those employment services. Also our allocation for emergency assistance or those crisis funds and other administrative costs. And then for the single adults or married children without dependents, it's through emergency general assistance allocation from the state, and it's specifically for emergencies for single adults, and the state determines that allocation as well. So because there are two funding sources for two different populations, we also have two different policies in place. Now, looking at the policies and just programs in general, there are eligibility factors. So there are multiple factors to determine eligibility for emergency assistance, but I'll just kind of cover the main ones, kind of the bigger subset of factors. So first, someone has to have a qualifying emergency. Again, that would be a threat of losing a basic need, like they have an eviction notice, a foreclosure notice, utility shutoff. They must be without the resources currently to resolve the crisis. So basically, we look at current income and current assets, and they don't have enough of those resources to resolve the emergency. Currently, funding with emergency assistance is available once every 18 months. People can apply more than 18 months, but they can only actually receive the assistance once every 18 months. Similar to other programs, there are residency and citizenship requirements, and there are current monthly income standards as well. So the current monthly income for the household and the household size has to be under 200% FPG. So just for an example, like a single adult, a single individual, if they're looking to apply for emergency general assistance, their income must be under $2,146 per month. And then if you look at, say, a family of four, their total monthly income would have to be less than $4,416 per month to be eligible under those income limits. Another one is the applicant has not used more than 50% of their net income within the last 60 days for purposes other than basic needs. So what this means is when someone applies, we request verification of all income within the 60 days prior to application. They also have to fill out other paperwork and list the amount of income that they have spent on various items. These can be basic needs like, what did you spend on shelter? What did you spend on utilities? Medical expenses, out-of-pocket medical expenses, child care, food. And then there's other items that are non-basic need. You know, did you spend things on pet supplies, clothing? Did you go out to eat? There's like a whole list of things that we have people fill out. And then what we have to look at is we total their net income, and we arrive at that 50% mark. And then we look at where they spent their income. And did they spend a majority of their income on non-basic needs, or did they spend a majority of their income on basic needs? So really, they have to have spent a majority of their income on those basic needs. And basic needs at this point include shelter and utility, I mentioned that earlier, food costs, medical expenses, transportation, and child care. So if looking at those expenses, if they have spent, say, over 50% of their income on non-basic needs, they're not eligible to receive emergency assistance because they have not allocated their income towards basically preventing the emergency if it's related to shelter or utilities. And another big factor is they will have to have anticipated income. So if we are going to fund an emergency, we need to see that there is a source of income that will allow the client to continue paying to prevent that emergency from occurring again. So they'll have to have income going forward. Even if they don't have income currently, if they say just got hired and they expect to start a job, we look at that factor of having that available income that will cover any, say, housing and utility costs going forward. So again, what can be funded with emergency assistance? So this kind of goes back to that definition that we covered earlier. So you're at the threat of losing an item of basic need. So that is rent, you have an eviction notice, mortgage or CD arrears, utilities like a disconnect notice. We can also fund damage utility deposits, first month's rent, in order to secure permanent housing. So say someone is kind of in that homeless status, say they're just spending time bouncing between friends and family, and they've located like a permanent apartment, we can assist with paying for those initial costs. And also moving expenses, a cost-effective move. So that could be someone currently has housing, but it's costly and not affordable going forward. And let's say they have located housing in another county and have secured a job and they need assistance moving, and that would be cost effective. The housing expenses would be lower. They've located that job. That again is something potentially that we could help fund and cover. So how much can we fund? Well, there's a list of factors that kind of get taken into account to determine how much funding someone could receive. So first is how much is needed to resolve the emergency. And there are limits for how much we can spend based on what we call our cash assistance standards. So both the emergency assistance for families and emergency for single adults, those income limits follow the corresponding cash assistance programs. So the MFIP cash assistance program income limits, and then the general assistance income limits. And so right now in our policy, there's about a limit of 3 times the cash assistance standard. So for example, say a single adult is eligible for funding. Currently, the monthly cash assistance for a single adult is $203. That's the general assistance standard. We could say times 3, that would be $609. So that is potentially what we could fund up to for a single adult. And going back to like that family of 4 example, that cash assistance standard per month is $721. Now, if we take that times 3, that's $2,163. So potentially, again, being able to fund an emergency up to about that $2,000 mark for a family of 4. There's also other limits identified in our emergency assistance policies. For example, we can only fund up to 3 months of past due rent. Applicants may also be required to contribute or pay if they have resources available, like they have money in a bank account. So we don't necessarily fund a request 100%. Again, a factor is if the applicant is able to contribute some of their resources or income towards that. And then we also have situations in which our funding is depleted and we've used and spent the full allocation for the year. So again, our funding ends when our total funds have been spent or depleted. So kind of going into some historical data, so we can kind of see the trends of applications and funding for emergency assistance. So this data is from 2017 through 2020. So on this graph, we're looking at the total number of applications for both programs. So again, using acronyms, EGA is Emergency General Assistance. And again, that's for the single adult or married couples without minor children. And then we say EA or Emergency Assistance, which is for families with those minor children in the home. So you can just kind of see, typically we have more applications for EGA, again, for the single adults historically. And that trend, we've seen an increase in applications since 2018. Again, the emergency assistance, we've seen less applications than EGA, and you can see that in the green line. So looking at 2020, last year, which covered a majority of the time with the public health emergency, we had 19 emergency general assistance applications, and we had 13 for families. So now just looking at emergency general assistance, again, single adults. I have, again, that chart, that graph with the total number of applications, but on the chart next to it, it has the breakdown of the number of apps we received and what was approved and what was denied. So you can see historically, out of the total number of applications that we've received, a majority are actually denied. In 2020, out of the 19 applications, only one application was approved, which left 18 applications denied. So historically, a very low approval rate. So you're probably wondering, well, why are these applications denied? That's a pretty large denial rate. So here's a chart with the various reasons that an application may be denied. And again, the number of applications that kind of fit into each category from 2017 to 2020. So some of the reasons, starting with, they just maybe withdrew their application saying, oh, I don't need funding anymore, I'm just going to withdraw this. Sometimes people have an incomplete application. Maybe there was a part of the application that they didn't, part of the application or paperwork that they didn't provide. So we have to deny it. Or maybe missing verifications. So maybe we asked for verification of income from that 60 days prior to the application and they didn't turn it in. Did not have an eligible emergency. So that is when someone applies for emergency assistance, but they don't yet have that verifiable emergency, like they don't have an eviction notice, they don't have a utility disconnect. So maybe they are like 1 month past due on rent and they're applying to see if there's assistance for them, or similar, like 1 month behind on utilities, or maybe they just wanted extra food support, or they needed help with car repairs. Those are not eligible emergencies per our policies to fund. The did not meet 50% eligibility requirement goes back to that eligibility factor of, again, looking at the income 60 days prior, taking that 50% line and then comparing that to the expenses that they spent their money on in those 60 days. Was it, again, majority spent on basic needs or non-basic needs? Again, if they've spent more of their money on non-basic needs, then they're denied for not meeting that eligibility requirement. And some of the other ones we see, they're not a Minnesota resident. They don't meet they're over the income limits. Maybe they have other resources available. They have enough money sitting in their bank account to resolve their emergency. Not cost effective. This is the denial reason for someone, say, not having that anticipated income, that income going forward. It's not cost effective for us to fund that emergency if they don't have income to keep them out of that similar emergency, say the next month or the month after that. So we say it's not cost effective. Again, they've received funding within the previous 18 months. This paid with other funding source. So this really, we saw this more applicable last year when we had those extra CARES funds available that we used to kind of extend funding for emergency assistance requests. So we paid a couple of requests through emergency general assistance and emergency assistance with those funds. And then funds depleted. So we've spent all of our money and unfortunately we can't fund anymore. So if you look at the bottom number, this is kind of the tally between all 4 years. So you can see really where the reason where a majority of the applications are denied. This is again for emergency general assistance. So the main denial reason is that the individuals applied and they did not have an eligible emergency. So over the last 4 years, 32 applications were denied for that reason. The second reason, highest denial reason, is not meeting that 50% eligibility requirement. So not spending a majority of their money on those basic needs prior to the time of application. And then you've just got some denials scattered out through, they withdrew their app, missing verifications, etc. So I just took those reasons and plotted them on a chart so you could really kind of see the groupings and where the majority of the denials were taking place. So then here is looking at the spending for emergency general assistance. So again, this allocation is determined by the state. Historically, we receive about the minimum funding, which is about $1,000, some years a little more. So historically, we have underspent funds. So the blue on each chart is the funds that we have spent, and the orange is what has remained unspent at the end of that spending year. In 2020, we actually overspent. This was, I would say, an unusual year that we typically underspend, but in 2020, we actually overspent. We were allocated $1,000 and we actually overspent by $361.50. And currently in 2021, we have not funded any requests. So we still sit at a full balance of $1,000. So kind of taking that similar information, but now looking at emergency assistance. So again, here's that chart so you can see the trend line. Number of apps, there's a slightly higher approval rate than emergency general assistance, but it's still fairly low. So looking at 2020, we had 13 applications, 2 were approved, 11 were denied. So that approval rate over the last 4 years has fluctuated between maybe like 20 and 50%. Again, taking the chart and the same denial reasons and looking at the totals at the bottom, the reasons, the main reasons why we've seen apps are denied, again, kind of similar to emergency general assistance. The highest reason is that the individuals just did not have an eligible emergency at that time. The second reason is they've actually withdrawn their app. And people can do this again for a variety of reasons. They're just withdrawing their application and not proceeding with the processing. And going back to that did not meet that 50% eligibility requirement against where they spent their money on prior to the date of application. This is the third main reason applications are denied for families requesting emergency assistance, whereas with EGA for single adults, it was the second reason. And again, just kind of drawing your eye to paid with other funding source, we did fund a request with those CARES funds last year. So similar thing, just taking that information, plotting it on a chart so you can see the groupings of those denial reasons. Now looking at the spending for emergency assistance for families, again, historically, we have underspent funds and we've had funds remaining at the end of the spending year that could have gone to families if they were eligible. So far, I'll just kind of backtrack down. So far this year, we have funded $596. So we still have about $4,400 remaining in our $5,000 allocation. Last year, we only allocated and spent, we just spent $628 out of the allocated $5,000. So that left an unspent amount of over $4,300. And again, just going down each year kind of fluctuates, but you can see there has been a pretty good chunk of funding available left at the end of the year that was not spent. So let's talk about updating our emergency assistance policies. So currently we are reviewing and updating our policies, and The reasons why is because they haven't been reviewed and updated in quite some time. So the MFIP Crisis Fund policy, this is the EA policy, was last revised and approved in 2010. And the Emergency General Assistance policy was last revised and approved in 2008. So a lot can change in 10 plus years. There's also some language and terminology that has changed over time, and that needs to be reflected in our policies. Like, for example, the previous language in our policies would refer to a family unit. Current policy refers to it as assistance unit. So we just want to make sure that we are updating some of those basic terms and languages as well. And some of it is also to clarify and enhance our language, really to make it more clear. So previously in our policies, maybe there was only one sentence talking about how to appeal, or one sentence that explained how your benefit amount was determined, how much we would fund. And there just needs to be some more information about that to make it clear, not only internally, but externally as well for people reviewing and reading the policies. There's also a need to compare policies to current state policies and statutes to ensure that we include specific requirements from those policies and statutes. In some areas, though, we do have discretion over some requirements in our policies. And again, in some areas, we do not. They're set requirements. And ultimately, looking at the historical data, we need to create more access to these programs and the associated funds. And so we need to adjust our policies where we have that discretion to create more access to those benefits. Again, we looked at the historical data to determine where we would be able to make those changes. Again, looking at where we have really underspent, and also looking at why are applications denied? Why are people not eligible? Do we have discretion over changing some of those eligibility factors? So looking at all of that information on why we should be looking at and updating our policies, these are the main updates that we are going to propose and are looking at with our emergency assistance policies. So applicants may now be eligible to receive emergency assistance once every 12-month period. So previously, this was 18 months. The minimum amount allowed is the 12-month period. So we don't want to make that longer by a year and a half. Let's just make it that year, that minimum requirement per statute. Although not many applications have been denied for this 18-month reason, 2 applications have been denied for this reason since 2017. So again, it's not a lot, but hey, potentially if we were able to assist 2 families and help them and get money into the community and bring them out of an emergency assistance, it's 2 families we could have potentially helped. And again, we have that discretion to change that, but we can't go less than 12 months. Another thing is looking at automobile expenses like monthly payments, insurance, registration. We're now going to consider them an item of basic need when we are looking at that eligibility factor of whether an applicant has spent a majority of their income on that in that previous 60 days prior to application on items of basic needs. So currently, automobile expenses are not considered an item of basic need. And being in a remote county and we don't have public transportation, an automobile is really, it's a very important piece of daily living. We have to have vehicles to get to work. We have to have vehicles to potentially go to school or education. There's various reasons why an automobile up here is an item of basic need. And we have discretion in this area, in those items of basic needs, that we have determined that we should be allowing this as an added expense. And we have seen applications, a majority of applications, I would say maybe about 50% when I looked back at them, that the person is spending money. They have a good deal of their income going to paying that monthly payment, insurance, fuel, etc. And if we count that as an item of basic need, more people will meet that eligibility requirement. We've also added a section, this is kind of more of that clarifying language piece. We've added a section on how the benefit, that funding amount is determined. Again, this really wasn't previously included. So we'll just clarify that we will look at the amount needed to resolve the emergency, potentially anticipated income and any assets the individual has, and then any money that they are expected to contribute towards that expense. And then we also added more information about appealing. There was previously only one sentence about someone's right to appeal. So just kind of added more information about the steps to actually go through an appeal. So in summary, upon making these updates, our policies will be current and they will provide more clarity about the process and procedures, both for the public and internally, and create more access to program benefits by adjusting the policies where we, the county, has discretion and ability to, and reduce the instances in which we have to deny applications. We want to be able to help more people. But of course, not every applicant is necessarily eligible for emergency assistance. And so there are other resources available that may be able to assist. And when we talk with applicants who are denied, we do refer them to these other resources and let them know that they are available. So one of the other resources is AEOA. They do have housing crisis and homelessness services. So they have funds for emergency situations, similar to funds that we have for like evictions and utility shutoffs. And they also have energy assistance. And we recommend that people apply for this yearly because that can help with those monthly utility costs. And they actually have a stipulation with energy assistance for helping cover utility emergencies as well. We also refer people to the Salvation Army. And then coming up, we will have the state will have their COVID-19 emergency rental assistance. So this is still pending. It is state funded. And this would be similar to like last year's COVID housing assistance program. But Grand Portage they did receive their own funding allocation for the COVID-19 emergency rental assistance, and they are currently accepting applications. So individuals on the reservation would be able to apply right now. And then even internally, our own social services unit, we do referrals to social services. They can provide services beyond what we are able to provide with just financial or economic assistance programs. And they have access to other funding sources as well. So that is the end of my presentation. So what I would like, I do have one question for you all before potentially maybe you provide me some feedback. So we have been discussing, are there potential other items of basic need that maybe we need to consider? And one of those items has been phone. Is phone considered an item of basic need? Is it a basic need similar to shelter or utility costs? Is it required for daily living? Is it an important piece? And what we would do potentially, if we do consider that an item of basic need, is potentially capping the amount that we allow to be counted towards that basic need calculation. Again, this would be allowing a partial phone expense when we look at that 60 days prior if someone spent a majority of their income on items of basic needs. So I want to throw that question and get your feedback. I want to pull you into the policymaking part, and I would love to hear your feedback on what your thoughts are about phone and allowing phone, again, a partial, potentially a capped amount in that list of basic needs.
Who wants to go first?
I will.
Andrea, go ahead.
Andrea. I think that's an interesting question because for a long time it seems like cell phones were sort of this like novelty, we don't have to have them, but in reality it's sort of become a necessity. So, if you think about different cell phone plans, I don't think that the entire cost necessarily would have to be counted as whatever the word, I can't remember now, a basic need. But I think that a portion of it seems reasonable that it could be a basic need because a lot of people don't have a landline. Some people do, but a lot of people don't because it's a double cost. And then, then you're paying even more money. So if they don't have that cell phone, they don't have the ability to contact their doctor. They don't have the ability to look for jobs or, any of those things that they would use in regards to basic needs. And a lot of things are internet based. So if you don't have data or internet, you're sort of disconnected from the world, which is sad, but reality. And that's all.
Okay, thank you, Andrea. Anne, I see your hands up. Oh, Allison, can you take the share screen down, please?
Yes, I sure will. Yeah.
So just to piggyback on what Andrea had just referred to, I'm wondering about instead of just phones, internet is another way of communicating. If it could be something that we call communication, and it would be an option as to whether to look at internet access and or phone, and then put a cap on that. And I like that idea of a cap. And wondering also with transportation if that there might be a cap on that. So something to consider. Thank you, though. I really like the idea of updating your policies and looking at things in a new way to provide more access for our families and individuals.
Anne, you were cutting in and out for me, so I didn't necessarily catch all of that. So you had mentioned potentially internet too. I know Andrea had mentioned internet. So if we add the phone expense, what are people's thoughts then on allowing a capped amount for internet?
Commissioner Storley, do you have a comment?
Madam Chair. I don't know, the audio seems to be coming in and out with Anne and am I clear?
You are, I hear you now. I was having problems with Anne too, but
okay.
Yeah.
Okay. Well, I guess in regards to internet and all that, it depends on if they have access to it. Otherwise, if they don't, it's prohibitive to put it in. And then how do you help them monthly, half a year? How do you help them with their phone to be able to access, like you say, health and their job and different situations that they're in? So I would have to give it a pause to think about. I think it is something to consider. Yes.
This is Sarah. I think I could maybe answer some of Jenny's questions since I do a lot of the phone work for our clients in public health and human services. It's a huge issue for our social services clients. There are a few free programs through the FCC where people can get like a free phone and a free monthly. But unfortunately, due to our rural area, these programs don't work for everybody up here. Like maybe if they live in town, historically, like up in Grand Portage, we haven't found really any of the free programs work there. And it's really important that clients have phones so they can speak with their social worker, make doctor appointments, apply for jobs. A lot of stuff's online. So we've had to get really creative in our department trying to find ways that to get this communication or internet or phones to people. And it's a huge challenge for our clients. And if they don't qualify for the free phones, then they're stuck paying a higher rate, especially like up by Grand Portage, where the only company that's available is like AT&T. And I think T-Mobile's finally working up there, but it's just so recent that has become a availability.
Commissioner Mills?
Thank you, Madam Chair. And just to qualify, just to clarify, these are for qualifying expenses. These aren't, or this is eligibility request. It's not direct assistance with a phone or with internet or with vehicles. These are just expenses that people have that are considered basic needs. And so I would say that yes, phone, vehicle, internet, all at this day and age basic needs, but I think it is important to have those caps in place. I can easily see where phone expenses can get out of hand as well as vehicle expenses very easily. So I think there should be a cap on what that qualification is or for eligibility, but absolutely I think all three of those, if we can include it, should be included.
Okay. Yeah, for the cap for phone, so when I was reviewing and looking for potential updates to our policies, I did look at our fellow region counties' policies as well. And there's a lot of consistency and similarities between the counties in our region. And then I also I was able to get some policies from DHS for counties outside of our region throughout the state of Minnesota, down like in the metro area. And we're all consistent in terms of what we consider items of basic needs. Actually, I would say that we're probably even including more items of basic need than other counties, even in the metro, where it's like shelter, utilities, and food, and that's it. And so we have allowed for more. And again, we are different than a metro area. But when I did compare our policy and looked at St. Louis County, they do incorporate phone as a basic need, and they do cap it at the amount allowed with our DWP program, the diversionary work program, and that is capped at $35. And when I think I have a landline, I would say that's pretty much what it costs to have a landline. Now, internet, so Dave, did you say internet is one of the three that potentially should be added?
I would be very supportive of that, and I have a landline that's $50 a month, just as a bare minimum with no long distance. So I think through Arrowhead, though, it can be as low as $35. But yes, internet is something I would be supportive as well.
Okay. And St. Louis County does have a cap of $100 a month for allowing internet as their basic need. And they are the only county that currently have phone and internet listed as an allowable basic need expense, again, to qualify for an emergency. The other counties in our regions currently do not have that. But again, that's where we have discretion, and that's why we need to review and update policies as needed to allow more people to be eligible. I do want to say, though, that currently in our proposed policy, when it comes to those automobile expenses, is that the individuals who will be able to have that as an allowable basic need item to determine eligibility, it's only allowed for individuals for employment or for medical transportation needs. So if they're not currently employed, then how the proposed policy is worded, if they have that vehicle expense like a monthly payment, they would not have that as an allowable basic need. It would be like a non-item, a non-basic need item for them if they don't meet that requirement. And that follows suit with how other counties have done it as well, is allowing those expenses for individuals, again, to get to work, those medical appointments, et cetera.
Commissioner Mills, I see your hand up again, sorry.
Thank you, Madam Chair. And thank you, Allison, for pointing that out about the employment side of things. It's a little bit of a chicken egg situation because it can be very hard to get a job if you don't have a vehicle. But this is that would be a very good step in that direction, at least, and we can see how it pans out. But are we restricted? Did you say we were restricted by the state with that eligibility, that only if employed?
Nope, that's not a set restriction. So we do have flexibility and discretion there as well.
Thank you.
Roger, I think I saw your hand up earlier. Do you have a comment?
Yes, thank you. People have to be able to communicate, and they have to be able to get to where they're going. And up here, we all know that communications is not easy, and getting to where you're going is not easy. So if there can be a capped expense that can be given out to folks to help make that happen, it may keep people employed. It may keep people able to communicate with childcare providers or medical providers. Anything that can help families in our community to stretch their wages or their benefits, to benefit them and their families. I think we need to do it and give it a really good look. It doesn't have to be fancy, and it certainly doesn't have to be carte blanche, but it certainly could be at least enough to cover absolutely basic phone, internet, and vehicle needs.
I guess, yeah, I agree. Phone, internet, it's kind of important things, especially families now and us all doing this and kids going to school online. It is a basic need, I think, for us up here. So I'm in favor of including it and putting a cap on it. Any other comments?
Yes, Madam Chair, this is Swallowson, and I agree with you, particularly with the pandemic. It's pointed out the internet piece of it, and I think reinforce that. So I'm in agreement with the other comments. Thank you.
I do have a question. I wrote down some things here during your presentation. Thank you so much for that. That was very helpful. I appreciate all the work you put into that. So when we get the funds that are not spent some years, does that stay in the county, or do we have to return that to the state at the end of the year? How does that work?
Yeah, good question. So it stays in the county. It just gets reallocated to a different, I guess I should say this is more for the MFIP consolidated funds. It just gets reallocated to a different line item, I guess is how you would say. So the MFIP consolidated fund is used to cover the administrative costs to administer the family cash programs. And then from that, we allocate the $5,000 historically for emergency funds. So whatever emergency funds are not spent at the end of the year, it's just reallocated to cover, really most of the time, administrative costs. So that would cover portions of, say, like our payroll for public health human services for the eligibility workers. The emergency general assistance, as far as I understand that, because of that is a specific allocation only for emergencies for single adults. If that is underspent, we basically lose it. It doesn't roll over to the next year. But if we historically underspend the minimum $1,000 state allocation, then we will really continually only receive that minimum amount. The state advises that if you do have requests and you would be spending above your allocated amount, so like that one year that we spent $361 over the $1,000 allocation, if counties continually overspend on their funding, then DHS will revise that county allocation. So we could potentially be allocated more money if we historically overspend on those funds. But really, if we underspend, it's money that we kind of lost out on for assisting people for emergency situations if they had been eligible.
Thank you. And I have another question about, do we track the ages of the, well, I'm thinking most the EGA one, the single family, the single people.
Single adults, yep.
Are they young people? Are they senior citizens? Do we know?
I did not track the ages, actually. A lot of the data, I pretty much had to manually go in and pull everything out. So I did not do data, but from what I recall, I mean, the ages range from, say, someone in their 20s up to someone in their 50s, but I don't have a great knowledge of where those ages lie at this time.
I just thought that'd be interesting to know if there's a pattern of this group of individuals probably needs more help than another one. I was just curious about that.
Mm-hmm.
And then another one that you said that some applications are denied because of the budget thing, whatever, the 50%. Yeah, but we're going to advise that so more people can possibly qualify. If they are denied because they aren't spending 50% of their income on basic needs, do we help them figure out a budget? Is there another, or do we just say, well, too bad and go away, go your own way? I'm just curious.
No, that's a great question. So yeah, it's really hard to deny people when we see where they have spent their money. Unfortunately, with our roles in working with strict financial and economic assistance programs, we don't really have a program in place to say, hey, we have to deny you, but we still want to offer you help. And so we want you to take this course in budgeting and money mismanagement, for example. We don't have that internally, at least on the income maintenance portion of Public Health Human Services. But there are local agencies like AEOA that does have class offerings, and they're doing them virtually now. And that actually is it has been written into our past policies and still is included in the revised emergency assistance policies. That basically, if we see a pattern of money mismanagement, especially if someone applies for emergency assistance a lot or is approved once every 12-month period, 12 months for the new policy, then we could still approve funding their requests, but they would have to partake in one of these budgeting or money mismanagement classes. And again, that's through AEOA. It wouldn't be a local offering because we don't have anyone here besides our employment services counselor. But through social services for our clients that potentially are working with a case manager or social worker, we hear that potentially is a service too. We have social workers who will sit down and work with their clients and figure out a budget, like, hey, where is your income? What are your expenses? We got to make sure that we're spending our money where we need to prevent that. So there are resources that we can direct people to if we aren't able to assist them with the actual money portion of their emergency assistance request.
Thank you. Yeah, I think it's important that we offer assistance, budget assistance, if we see people continually needing help like this. So
absolutely. I mean, one of our roles not only determining eligibility and basically approving funding to people, we're here to help promote self-sufficiency. And we want to assist people in those types of things. So any type of resource that potentially could be available to them, if we see that trend, we don't want to just say, hey, you're not eligible and we can't help you. That's not our role. So we will do what we can to get people connected with the resources possible, whether it's in-house or out of house.
Thank you. Any other comments from anybody? So when do you expect your policies to be in final form for?
Yeah, well, I greatly appreciate the feedback on like the phone and internet. So what I'm going to do is I'm going to include those updates and come up with a final draft policies, because there's two policies, And then I talked with Allison, so we will get them on the board agenda for May to get those approved, effective to roll it out and really start with the policy on July 1st. So having them presented and approved in May will allow some time for internal education and review of those updated policies. So we are set to roll with it July 1st.
Okay, great. Thank you, Allison. I really appreciate all the information you gave us.
You're very welcome.
Madam Chair?
Go ahead, Commissioner Mills. Sorry,
Thank
didn't
you.
see your hand up there.
Yeah, thank you. I did have one other question, and sorry if I missed it. Is there a cap proposed on the vehicles, and what would that amount be? Vehicle expenses?
Yeah, so if that's something, I guess that was kind of something left up in the air. So with the vehicle expenses right now, we don't have a proposed cap, but we would allow it as an item of basic need, again, for the eligibility determination for those that are employed or it's needed for medical travel. So potentially what we could do is we could remove that for employment or medical travel. We could allow it for any applicant. And then I would support a cap. I think that would be appropriate, but I don't know where we would want to set that cap. If it would be a total combination of monthly payment, insurance, registration, et cetera, at like $500, $600. I mean, I think it's a reasonable expense to see, say $300 to $400 for a car payment for an individual, but everyone is going to have different needs and what they need for a vehicle. Size of family, are they self-employed? Maybe they need a truck and that could be more expensive. And we don't want to limit someone's ability to be able to, individuals need to have a reliable vehicle, which tends to mean a higher monthly payment. If they have an older vehicle and they don't really have a high monthly expense, then they're probably going to not have an overly reliable vehicle. So I honestly, we see expenses all over the board. So I really don't know where an appropriate cap would be.
Thank you. Yeah, and I don't expect you to know, but I wanted to bring that forward to discuss, and I don't know either. But I do think, we can't. I don't think it's reasonable for us to be able to cover any and all vehicle, expenses. That's why there's a cap, and so just something in that medium range, and then that's going to help people, even if they do have expenses that are greater. It will still allow them to have that be part of the eligibility. So anything would be an improvement, and I do fully support expanding it beyond medical and currently employed situation too.
Sounds good. Well, what if, policies are progressive. They're not meant to be done at one point of time and then never to be updated again. So my goal is to continue to track how these updated basic needs affect eligibility. And if we notice that anything needs to change, be added, taken away, et cetera, hopefully not taken away because we never really want to do that, but just throwing it out there. If anything needs to be modified in the future based on the trends that we will see starting July 1st going forward, we always have the ability to do that. So if we wanted to start at a cap of, say, maybe $500 total with any of those automobile expenses, that might be a good starting point. And then again, we can just see what the trends are and reevaluate it at a later time.
Now, a quick point of clarification for the board too, in looking at a cap for vehicle expenses, these funds would not be used to pay vehicle expenses for an individual requesting assistance. This would be for someone who's in housing crisis. So I think in that regard, I would consider not having a cap on vehicle expenses. How realistic and cost effective is it to suggest that someone get a less expensive vehicle? at the point that they're facing homelessness or looking for a more cost-effective place to live. So again, the cap or the amount that would go towards vehicle expenses would just be used to reduce the available income that they have in the month that they're requesting. Right, Allison?
Correct. Yeah, it's having that additional cost included as an item of basic need will hopefully allow people to meet that specific eligibility requirement, but it doesn't change what we fund as an emergency assistance.
And if I could say something too, in alignment with what Allison McIntyre just said, emergencies come up suddenly. None of us plan emergencies, and all of a sudden we need something extra that we hadn't anticipated. And so I support the idea of just being really flexible with cars, and because Allison is right, purchasing a car and making all those changes are immensely stressful. And so we wouldn't want to, I just think we should be really open to when we've had emergencies in our past, and that definitely they're an emergency because they're unanticipated and they're unplanned for because something unexpected happened for the vast majority of us. So.
And if we don't cap it, I would still recommend a cap of one vehicle though. If a family has more than one vehicle, like a 2-parent household, and they each both have a vehicle, in other counties that are allowing the automobile expenses, they do limit it to applying to one vehicle. So I'm just going to throw that out there as well as a item to think about.
Madam Chair.
Yes, Minister Yorkie.
Yes, I just wanted to say thank you to Allison Plummer for the presentation. It really helped me understand our emergency assistance programs better. And I really like the policy changes that are being proposed. I think anything we can do to make this program more responsive to the needs that we're seeing in the community is a good thing. So thank you.
Thank you.
Thank you. We'll go to Allison and the director's report now.
Sounds great. Thank you again, Allison. And we'll have an updated policy for you to review and consider next month, as Allison said.
Hi, everyone. Thank you.
I put together a PowerPoint to go along with my report today. So are you able to see that?
Yes.
Great. Okay. So continuing on with updates from our economic assistance unit, I'm happy to share that our economic assistance team has exceeded all performance standards for 2020 for application processing timelines. So as you can see in the left-hand diagram here, I'm sorry if it's a little small on your screen, I can send it out in an email. Our team has processed 100% of all applications received in 2020 within the timelines mandated by the Department of Human Services. So we, again, are showing that consistent upward trend, second year, 100% compliance, and really outpacing the state and region in terms of our regular SNAP and cash applications. This other diagram here shows the percentage of applications for the SNAP program only. Again, that's food support for those individuals who have an emergent need. So their available resources are less than their expenses. Those individuals we're required to process those applications and address assistance as soon as possible. So in 2020, our team here in Cook County processed 84% within one business day. And that is significantly outpacing our regional partners and the state average. As you can see, state performance and regional performance both declined in 2020, while our performance actually increased slightly. So kudos to that team. In addition to the report from the Human Services Performance Management team, we also received a certificate of achievement from the state SNAP unit, quality assurance that over 96% of all SNAP applications, both for those that qualified for emergency assistance or assistance right away, the expedited processing, and the 30-day regular processing. Again, 96% last year were processed within those state mandated timeframes. Within public health, not much to share since you last received a report from the EOC and Grace and Mike at the regular board meeting last week. Our efforts are continuing to shift from managing the demand with vaccine to increasing outreach and accessibility with our continuing goal of vaccinating 80% of county residents to achieve that community immunity protection. Also want to recognize Grace for presenting at a conference last week. In addition to her busy work, she presented at the NACCHO conference on challenges in rural public health workforce during the pandemic. Also happy to share from public health that we were contacted by another local student who's interested in serving in an internship with our department. So we will bring more to share at a future meeting about this individual and her project. I'm sorry I didn't get a slide for these updates, so you're just having to look at the SNAP certificate, but one more update from Human Services, that as a complement to the internship project with Sarah on transportation and a compliment to Martina for all the time that she put into it. Want to recognize her for submitting a grant application to the state for a Live Well at Home grant. Martina did a lot of work with partners, including Kay at Care Partners and our regional ARDC representative. And we will share more about this grant application if we are successful and awarded that grant. But it would be to expand accessible transportation resources to residents in Cook County. I neglected to get this on the agenda this month, but just a heads up that next month we will be calling a special meeting for the PHHS board in August, on August 3rd, and that will be for our 2021 budget presentation. And I'm going to use the rest of my report today to outline a proposal that will be forthcoming to expand our behavioral health services within the department. We've recently learned of the resignation of two key staff through Ascend Services, which is a local mental health provider. And as a result, we are exploring certification to expand our resources within PHHS. And Andrea, Roger, and Rana heard a bit about this last week at our local mental health advisory council. Again, there's no ask today. This is really just a, oops, sorry about that. Really just a an overview, laying the groundwork for a proposal that will be forthcoming. So in Minnesota, our public mental health system is supervised by the State Department of Human Services and administered by counties. Counties have a role as the local mental health authority, which means we have a role in assuring a stable continuum of care for county residents who have been diagnosed and are recovering from mental health struggles. The Mental Health Act authorizes our formation of local mental health advisory councils and other activities as a department. We also receive funding through the state, which is allocated to regions to support mental health services. Mental health service delivery is composed of 6 key components, the foundation of which is a diagnostic assessment. Diagnostic assessment is necessary to determine eligibility for mental health services paid through Minnesota healthcare programs, so medical assistance, for example. Diagnostic assessments, as you might guess, identify a diagnosis, health diagnosis, and recommend services or determine that an individual doesn't meet criteria for services. And this is the basis for an individual's treatment plan. A diagnosis can only be made by a licensed provider, for example, a licensed independent clinical social worker or psychologist. And they're really the first step in providing mental health services to adults and children. There are several providers locally and in Duluth who can conduct diagnostic assessments, and without this, a service plan cannot be developed. It takes time to conduct a diagnostic assessment, or DA, and it's really that jumping point off for therapy and billing for services. The role of a county case manager is to complete the other assessments, the diagnostic assessment and level of care assessment, and determine how best to assist an individual in their recovery. In our department, there is one adult mental health case manager and one children's mental health case manager currently. Community support for developing skills that support recovery are provided by mental health providers, and these are often individuals who have a bachelor's degree and 2,000 hours of supervised work experience working with children or adults. That supervision is provided by mental health professionals. Again, those are licensed professionals, and that's considered clinical supervision. Persons who provide skill development supports to adults are billable to Minnesota healthcare programs as adult rehabilitative services, adult rehabilitative mental health services, or ARMS. I'm going to be using that acronym going forward. So those are skill services to adults and children's therapeutic support services, or CTSS. In order to bill for these services, an agency must be certified by the Department of Human Services. And that is, again, to assure that the program has the proper oversight, clinical supervision to provide those services. And again, agencies who are certified are able to bill for services and be reimbursed. In the past, ARMS and CTSS services were provided in Cook County by the Human Development Center. HDC, as our community mental health care clinic, provided an array of services across the mental health continuum. And with the departure of HDC in 2018 from Cook County, this left a major gap in services in our community. Since that time, gaps have been filled through the Sawtooth Mountain Clinic behavioral healthcare team. They've added 3 providers to their staff. And these providers are able to conduct diagnostic assessments and provide therapy services. Both PHHS and Grand Portage Human Services have added community mental health support staff who are able to provide direct mental health support. And these community support staff are really targeted at supporting people who who aren't eligible for billable services. So in the past, HDC had both skills staff who provided ARMS and CTSS and community support staff who were able to support people who weren't eligible either because of a diagnosis or because of their funding source. In recent years, Ascend, which is a for-profit agency, has increased their reach in our community, and they were able to fill in some gaps with ARMS and CTSS. They were also the recipient of the School-Linked Mental Health Grant, which provides services in the schools, those CTSS supports services. And that grant is set to end in 2021. Again, as I started out, we recently learned that 2 individuals employed through Ascend who provided ARMS, CTSS, and therapy services have resigned. And again, these providers were also able to conduct diagnostic assessments. The departure of Ascend leaves a significant gap in Cook County. While we are hopeful and confident that they will be able to fill those positions, there are significant barriers that exist in recruiting new providers and retaining new providers, really systemic challenges that you all are quite aware of, including affordable housing, childcare. Ascend is recruiting for a number of vacancies in Duluth right now, which speaks to the demand for service providers throughout the region. Given the need for stability for ARMS and CTSS providers in Cook County, and the importance of staff who conduct this work as a part of the team, PHHS is proposing completing the certification process for ARMS and CTSS and working with the Sawtooth Mountain Clinic or another partner to provide that necessary clinical supervision. And again, this is what we feel is the best option for ensuring stable supportive services going forward. I'll just draw your attention to these graphs here on the screen, or these diagrams showing that Cook County has among the highest service gaps statewide with the lighter color shading. And these may not reflect the more recent changes in services locally. And Grand Portage isn't even included as a tribal nation, which is concerning. So in our proposal, this diagram here illustrates proposed changes to the PHHS structure. And this includes planned changes, and expansion of substance use disorder case management and daytime crisis response, as well as some of the newly proposed expansion of behavioral health services, including the addition of ARMS and CTSS. So what we are proposing is pulling behavioral health services out of the Children and Family Services unit. If we were to add another staff within Children and Family Services unit, that would be 8 staff under one person, with the development of 2 new programs is just not feasible or sustainable at this point. So what we are proposing, and again, a more formal request with budget justification will be forthcoming. This is just to lay the groundwork for the request. But we are proposing is to hire an additional supervisor in human services to really oversee the development of this expansion in behavioral health services. So this would be a supervisory position. And then we would be moving the mental health case management staff, the substance use disorder case manager, our current community support provider, and the addition of the CPSS worker into the behavioral health unit. So again, we had already planned and included in the 2021 budget the addition of substance use disorder case management. Initially, we had proposed this as to be paired with licensing. In the short term, we are proposing to retain licensing within the intake position and then explore options for a regional service delivery model. I've had conversation with some of our partners in the region about whether there would be interest in exploring something similar to what other counties in northwestern Minnesota have done in a regional service model for licensing. We are also in the process of pursuing daytime crisis response. As you know, this is another initiative in response to the closure of HDC in 2018, in really expanding and enhancing the services that we provide through intake and adult mental health services and children's mental health services in PHHS. There's a potential that we could have internal candidates that would be interested and qualified for this position. We are exploring, alongside pursuing external clinical supervision, that we might be able to hire someone who has the ability to provide that clinical supervision of staff as well. And then again, it would be the proposed addition of the 1 FTE ARMS and CTSS worker, which is in alignment with our long-range goal when we added community support staff back in 2019. And again, the recent departure of ASCEND staff just reinforces the urgency of moving forward with this plan. These positions do generate revenue. They are providing billable services through Minnesota healthcare programs. We're unsure what the revenue would be at this point, but we can provide more information in reaching out to other counties in the state that are providing this service as we continue to develop the proposal. In addition, we'll be able to look at what the level of need is. It's difficult to determine, what the caseload would be, for example, for an individual, as services have been limited for some time. We do know that our current community support worker has never had a wait list, or has never not had a wait list. He's quite busy. And ASCEND staff as well, we know had rather large caseloads of people receiving both skills and therapy services locally. Just a summary of our next steps internally. What we will be doing is developing a position description for the Behavioral Health Services Supervisor to present to the Personnel Committee, and of course request board approval to post along with the 2021 budget revision. We will present that proposal and the impact on our 2021 budget at a future PHHS board meeting. We will revise the current vacant position, the substance use disorder case manager, and repost that vacancy. Again, that one is included in the 2021 budget. We will pursue certification to provide and bill for the ARMS and CTSS services with the Department of Human Services. There are trainings available. And again, we can learn from other counties who have stepped into this realm of providing direct services as well. A key piece will be to either revise a current subcontract or develop new contract with a mental health provider to provide that clinical supervision. Again, Sawtooth Mountain Clinic is currently providing clinical supervision of our mental health case management staff. We've had an initial conversation with Kate at the clinic about whether or not there would be capacity to expand that. We also have an opportunity with the Human Development Center as they are providing or will be providing clinical supervision of our daytime crisis response staff to potentially expand that as well, or at least to partner with HDC as we move down this path. And again, as I mentioned earlier, there's the potential to hire a supervisor that would have those credentials to provide supervision. An important next step for us as we begin to develop this plan internally as well is consultation with partners that have a key stake in this decision. I've already been contacted by one local school administrator to advocate for PHHS to pursue certification for school-based services. And what he shared as really the detrimental impact on students and families with the amount of turnover that the schools have seen over the last few years with school-based services, and would certainly consult with other schools to get their input and support. Again, we've had preliminary conversations with the clinic, but would also be reaching out to Grand Portage Human Services staff to talk through this proposal. I shared a brief overview of the gaps and our tentative proposal with the local mental health advisory council last week. And we'll also present to our public health and human services advisory council next month, as behavioral health services was one of our strategic priorities, for our community health assessment and improvement plan. We'll also complete a health lens analysis tool, which was a resource developed by public health in 2019 as we considered commercial tobacco policy changes, and that could help identify other stakeholders and important partners to bring into this work going forward. And finally, a major barrier in considering this expansion is physical space within PHHS. As many of you know from the tour a couple weeks ago, we are very limited with office space and have already had to get quite creative in pairing up staff, and within the last year at least, having staff split schedules, working from home and in the office to achieve some of those physical space distance required during the pandemic. So we would need to find some additional creative solutions in reworking our current space, having staff commit to a more permanent work from home, or look at additional options within the community for housing. Again, we have one vacant workstation right now in PHHS, and this proposal would include a change of 2 FTE. So we would not need to find a place for one person. And that's all I have for the summary. I'm happy to take any questions about what we're proposing here. I brought back up the org chart if that's helpful, or I can take down the screen share, whatever's your preference. And Grace Bouchard is here as well to be able to address any questions as it relates to the impact on our case management staff, which is is significant. And one of the reasons that we advocated for hiring a community support worker in 2019 is that in absence of those skilled staff who can provide that direct service in individuals' homes, in the communities, our case managers are often acting in dual roles as case manager and skill worker, which is very complicated, especially as they're pretty maxed out on people that they're serving already. So what would be helpful in terms of information in evaluating this request? Or what questions do you have for me initially?
Madam Chair.
Sterling, go ahead.
Thank you. Thank you, Allison. This is, I guess, interesting report for us to see for the first time. Would you be able to put together kind of this report so we have something to look at, because it really will affect the budget, and kind of something that we can kind of go by in the next few months? Would you be able to do that?
Absolutely, yes. I can share the report and summary here, and then we'll be presenting at a future meeting once we have more information about what this new position would be classified at, what that budget impact would be, and any impact on our bottom line for 2020.
Right. Way before the budget meeting. Thank you.
Any other commissioners have any questions, comments?
I would just like to comment if that's okay, Stacy.
I can't see everybody anymore, so just speak up. I think that would be great. Thank you.
Okay. This is Grace. I just wanted to comment. I agree that this is a lot to digest, and it's complicated and a lot of moving parts. So I really appreciate your thoughts and comments on it. Traditionally, Cook County has paid direct dollars, county dollars, to the Community Health Clinic HTC to provide a lot of these services, to offset the costs of services that did not have a funding stream. And part of the struggle with this all is the system that we work under. For example, Medicare does not have a funding stream to pay for people to do CTSS, of course, but there are people who are grandparents who, I guess that was the wrong thing, but they don't have a funding stream to pay for people who need adult mental health rehabilitative services. So if you're solely on Medicare and not on medical assistance, there's no funding stream. What do? We've just seen an increased number of people of older ages who are seeking out mental health services. And so we need to figure out how to respond to that. Another variable from the system is that private pay insurance doesn't have a funding stream to pay for skills services, for the children's therapeutic support services. So it's great to have people employed and have private insurance, but there's no funding stream to pay for it. So those children are in need, and we don't want to place people in situations where they have to leave their job so that they can provide the level of care that their children need. It's a very complicated thing. And I think that we need to, our thoughts on this are evolving as we work through and put it on paper ourselves. And so it's not that this is written in stone, but it's also clear that the turnover is exhausting. It's exhausting for our families and children and adults who need these services. Recently, one of the individuals who resigned from Ascend, I know that Anna, who is our adult mental health case manager, spent hours and hours on the phone listening to people cry, and they're so upset. They said, just finally trust this person with these big needs in my life, and now they're gone. And I don't know that I'll ever work with an arms person again. And looking at the cost and the cascading effects of individuals who don't get skills services or therapeutic services, that could lead to people being hospitalized. It could lead to death. It's very complicated and very hard to figure out how to respond to best. And so again, this is our starting point. We feel a team that's really dedicated to behavioral health will really be strong. I can say that, Allison, I do a variety of things, and no person because I've grown up with all these various programs, it would be really impossible for somebody to take over this set of programs that I'm involved with. And so I think setting ourselves up to have a dedicated behavioral health team would be really, really strengthening and really, really positive. So again, I really appreciate you listening, and I totally understand that this seems big and complex, and it's because it is. And that's why we're here to present it to you and get your questions. And please don't hesitate to say, but what about this? So that's what we're here for.
Thank you, Madam Chair, and thank you, Grace, and thank you, Allison, for presenting this. And it is huge on many different levels and from many different directions, and much too large for us to discuss in the negative 10 minutes that we have. And so what I would hope is we could have a dedicated meeting potentially just for this, if we need a special meeting of the Public Health and Human Services Board to discuss this exclusively. I think that might be really helpful, and probably sooner rather than later, as the need is already here. And so that's as far as I've gotten.
I think that's a good idea. I think this one there's a lot to take in here. Yeah, a lot more things to think about. So I think if we do have a special meeting, a committee of the whole type meeting where we just discuss and discuss this issue and what our options might be, I think would be a good idea.
I would love to get your questions ahead of time so that we can do some research around the funding streams, the reimbursement rates, the cost of care, and the risks, benefits, all those things. So I think that I would love to participate in that.
Everybody, homework is to send your questions into Grace and Allison. Any other comments? Okay, so I realize we are running over again. There's just so much to learn here. We may have to move our committee of the whole meeting back a little bit because I hate to rush through this, but I do know that we're going. Mr. Yorkie?
Yes, I just wanted to let you know, Madam Chair, that I've had April contact our guest presenters for the committee of the whole. They know that we're running behind, and I told them we'd get with them as quickly as we could.
Thank you. So if there's no other questions, I think we'll move on to the items of board action, which we need to take care of today. Allison, do you want to talk about anything?
Yes, so before you, under items for board action, are approval of our public health subcontracts with the Sawtooth Mountain Clinic. As I indicated in the summary, these are all contract renewals, with the exception of the COVID-19 vaccine support and oral health task force. The COVID-19 vaccine support are funds that are allocated through our community health board, and we have turned around and reallocated those back to the clinic as they are providing all of the nursing services for the vaccine events. The oral health task force historically was a standalone nonprofit and is now incorporated within the Sawtooth Mountain Clinic. The oral health task force applied for public health funding through the public health grant making process last year. And those discretionary non-mandated funds that the board has given authority to public health and our subcommittee of the PHHS Advisory Council to offer recommendations. And as a part of our review and grant making process this year, we proposed folding that contract into our subcontracts with the clinic rather than having them apply as a competitive grant process, and that we would model that after our contract with the hospital for home care services. We're essentially offsetting the cost of providing that important service that is in alignment with our mission and goals in our community health improvement plan. You'll notice a variety of grant terms and periods, and those again are all in alignment with the state grant periods. These are all funds that come through our community health board to support public health work in the community. And again, we are continuing with the clinic providing many of those services on our behalf. Commissioner Hawkins asked about contract summary reports from the clinic in terms of the numbers of individuals served through these programs. And typically the clinic will come before the PHHS board and provide a year-end report. So I will work with Kate Serbat, the clinic, to make arrangements for a future presentation so that you can hear more about their great work in community health improvement, promotion, and public health from those staff providing those programs. I'm happy to take any questions about the approval of the subcontracts.
Do you have any questions, comments?
Madam Chair, this is Commissioner Mills, and I move to approve the purchase of service contract addendums with the Sawtooth Mountain Clinic for Public Health Services.
And Commissioner Swallowson seconds.
We have a motion and a second. I'll do a roll call vote. Commissioner Mills?
Aye.
Commissioner Swallowson?
Aye.
Commissioner Storley?
Aye.
Commissioner Sullivan?
Aye.
Andrea Orris?
I have to abstain as a Sawtooth Mountain Clinic employee.
Roger?
Aye.
Thank you. And Commissioner Hawkins says aye. It passes unanimously. Okay, now we are get down to our committee reports, and since we're running time, I'm just going to ask if anybody has anything urgent that they would want to report on. Make sure that we all know. Commissioner Mills, go ahead.
Yeah, and I'm not going to do anything specific, but I just want to point out that with some of these programs that are coming to the county, a lot of it is our responses and not as much, I feel, as preventative. And so with some of these committees, particularly the Community Health Board, there's more and more programs that are really looking at preventative measures to really help community health. And I know that $1 in prevention is however many in what's that saying? You know what I'm trying to say here, though. And that's really where I think the answer is in prevention. We do need to respond and we do need to help, but if we can get ahead of it, it's just going to help everyone in every way much more. So that's the only thing I have to say. Thank you.
I agree. It's better to think about the problems and not cause them, figure out a way around them before you get there. Yes, I agree. All right. So we all have to get to another meeting 17 minutes ago. If there's nothing else, I will entertain a motion to adjourn.
Commissioner Swallowson moves to adjourn.
Thank you. We have a second.
Storley support.
Thank you. We'll do a roll call vote. Commissioner Swallowson.
Aye.
Commissioner Storley.
Aye.
Commissioner Sullivan.
Aye.
Commissioner Mills.
Aye.
Andrea.
Aye.
And Roger.
Aye.
Aye. Thank you. And I hope we can have a 5-minute break before we see each other again.